Thank you very much for listening and coming to my session this afternoon. Hopefully it will be a little bit different to what you've already heard this morning, so we'll move swiftly on. So yes, I'm extremely lucky to be working in my role because I'm a nurse by trade, critical care is my background, and for one reason or another got into procurement. And when you talk to most people that work in procurement, they say, well, I just sort of fell into it. So that was 8 years ago, and I'm still doing it because I love it. It speaks to all my values. Patient safety is the first and foremost. We make sure products that we get into our organisation, so Samuel West Birmingham and the Dudley Group, are safe for patients. We also make sure in the clinical procurement role that we're buying things that offer quality of care. We're sort of interested in price as well, but that's more about the procurement stuff. From the nursing side, we're very much about, is this going to be the best product for our patients? And generally, the quality of care then drives your savings. But more recently, and why I'm still in the role 8 years later, is because I've introduced the sustainability theme into what we buy in our organisation. So I just wanted to, first of all, put your hand up if you think you've got a clinical procurement nurse in your organisation. Less than half, I'd say. Put your hand up if you're not sure. A few more. Find out, because we're fab, and we'll really support you in doing whatever it is that you need to do in your particular organisation from an infection prevention point of view, but also around the sustainability role as well. Final question before I actually get cracking. Would you say that your organisation considers sustainability when it buys its products? Put your hand up if you think it does. I'm glad that my trust colleagues are putting their hand up. So probably about a third. For those of you that haven't got your hand up, I'd like you to go back and challenge your organisations as to why. Either that's not happening or you don't know that it's happening, because it's a really important question to take away today. So this afternoon, we're going to talk about how and why is sustainability important from a nursing perspective. There's about 760,000 nurses on the register. Apologies for my friend the ODP in the room, I'm sure there's more of you. But it's really important that nurses take this agenda forward, because there's lots of us and we're the most trusted profession, and it's within all of our gifts in this room to go back and do something different about how we work. And we know that the impacts of climate change on human health are happening now, and we talk about climate change, and some of us kind of think it's happening in the future, and some of us know that it's absolutely here now. And we've talked a lot, haven't we, already about bacterial resistance, multi-drug resistant bacteria, and some of the impacts of climate change are just going to make that a whole lot worse. Other things that we know, this is a World Health Organization slide from the CDC. So I'm not going to go through it in detail, but you can see that everything that impacts on health from the climate is just on that slide there, and it's quite scary. Particularly interesting, I think, is the malaria, the Lyme disease. One of my friends came back from Thailand with dengue fever. So, you know, we all travel, and I think that was clear in one of the presentations this morning, that just because we live in the UK doesn't mean we're not impacted by some of these weird and wonderful vector diseases. So a nod to IPC, because hopefully most of you are in that world, but I thought it'd be really useful to start off by looking at how we break the chain of infection, which I'm sure none of this is new to you. But where do you think you could identify opportunities in what you do around your IPC role? And how do you think there's opportunities there to reduce the environmental impact of those interventions? I think the one that stands out for me most is really around hand hygiene, and interesting to hear what Yvonne's saying this morning about it wasn't the most important thing to do all of the time. But it lends itself nicely to talking about some of the work that Rose did at the Royal College of Nursing around gloves off, which has continued, hasn't it? And it's been a really successful campaign to tell folks to take their gloves off. But I don't know about your organisations, there's still quite a lot of work to do there. So I think for me, we'll perhaps come on to that a little bit later, but what we use in our care is impacting the patients, and it's also impacting the planet. So if we can use less of things, or we can reuse safely things, then that's got to be good for the planet. The only other thing to pick up on this particular slide, I think, was when you are cleaning, use a plastic containing wipe versus a reusable microfiber cloth. Now, I know we've got a couple of organisations outside that are talking about hypochlorous acid. We've looked at it at our organisation. I think it's really important to think about what it is that we use to do that cleaning. Is that the most environmentally friendly way that we can do the cleaning? But also the impact that has on our staff. So at the moment, we open a wipe and we can clean our surfaces down quite easily. If we've got to go out and do another process and we're asking our really busy staff out there to have to do something different in their daily routine, then we've got to think really carefully about the balance between what's good for the planet and what's good for the patient, because a wipe is really easy to grab and go, whereas some of the other alternative solutions that are great for the planet also might be great, but we need to think through how that will work in our processes that we've got in our busy ward environments. Oh, the final thing to say about this was there was a consultant ENT surgeon. Some of you may have heard him speak before. His name's Mood Booter, and he is really strong on circular economy and reusing products, and he calls it yellow washing. So when you go to IPC and say, can I reuse this? There's this assumption that IPC go, oh, no, no, no. But actually, have we asked them and have we asked those questions? And Mood calls that yellow washing, and I think that's a really sort of nod to, you always get the blame for things for saying no, but most of the time that's not the case at all, and it's just that we haven't asked you. And so one of the strap lines in my session was about not falling out with your IPC colleagues and having that collaborative conversation about the things that you want to introduce in your organisation. Oh, handily, wouldn't move on to the next slide, because I'm going to ask everyone another question to keep you all awake. Can you put your hand up if you've heard of the Sustainable Development Goals from the United Nations? Okay, quite a few. Probably more than you've got clinical procurement nurses, so that's not bad. So yes, in 2015, it's still not moving on, hang on, there we go. The United Nations came up with, collaboratively, Sustainable Development Goals, and this was about, the 17 of them, and it was about how we were going to make sure that we're living in a world that is sustainable long term. So those are the different themes that you can see up there. And I've just put some square boxes around the ones that I think are really relevant to my role in clinical procurement, and probably yours as well in IPC. Particularly important for me is number 12, responsible consumption and production. So everything I buy generally has touches the patient, so it's really important that it's safe, as I've mentioned already, but also where has that product come from and what's it made of. So Sustainable Development Goal 12 is really important to us in clinical procurement. Another thing that's overlooked often is the life below water from our profession, but from what I've heard this morning, it's really not overlooked by your teams at all. The impact of what we do and where we flush things and where those things go is really impacting on our aquatic life as well. But interestingly, also the stuff we buy comes on container ships often, doesn't it, from far afield. And those container ships can really impact the biodiversity of the mammals and the fish that live in the ocean. And then guess what? We fish them and then we eat them. So it's this awful circular impact that we're having by giving care to our patients. So whilst we might not produce, we're only about 4% of the carbon footprint in the NHS, what we do does matter. So I'll show you the Sustainable Development Goals, but the 2024 report from the UN shows that we're really not doing very well on them at all. So we've got a long way to go to be able to say that we've achieved them. We keep having these COPs, don't we? And we're hopeful that they're going to come out with some great agreements, and then it turns into not as much impact as I think we'd all like to see. And it makes sobering reading there. And what's quite scary is that over a third of the progress on those SDGs has actually regressed. But Trump says, please don't share this with anybody on social media because I'm actually going to Denver to present later this year. And if you share this, they won't let me in. But Trump claims that we don't have a problem and he wants to drill, baby, drill. Was it just me that was, oh my goodness, we're doomed really, aren't we? But we're not doomed, and this is why. So you won't let me move on my slide now. You won't. There we are. So actually, the share of people who believe in climate change and think it's a serious threat to humanity is actually really quite positive. So The dark blue is between 90 and 100% of the population that have been surveyed say that they believe that it's a problem. Interestingly, in the States, it's somewhere around 70%, maybe 60 to 70% of their population. And this was in 2023, so Biden's time. But interesting to see that people do believe it's a serious threat to humanity. So if you're with me in the room and you're not a climate denier, you're in that sort of ballpark. And really great as well, because we've got the council elections tomorrow, and use your vote wisely, but the share of people who say their government should do more to tackle climate change is also really high. In the UK, it's looking between 70 and 90% of our population think that our government should do more. And as Rose mentioned in the speech this morning, the government have now come out and said they're not doing enough. So hopefully that's good. They've admitted that we need to do more. What are they doing? Well, the drivers for change, it's interesting that the UK plans from the UK government that were originally drawn up by the Johnson government has been picked up by the Starmer government, and they're still committed to the same net zero goals. So that's one of the drivers for change. And we've also got the UK net zero emissions target. We've also got our Black Country Integrated Care System Green Plan. And I'm going to ask you again to keep you all awake. Has anybody had a chance to read their Trust Green Plans? Not many. Go back and have a look, because your IPC and your nursing voice needs to be in your Green Plan. And actually the Green Plan refresh, which has come out it's got to be due, I think it's July this year. There's a very clear ask that there's clinical transformation in your Green Plan. So there has to be a clinical lead in your organisations that's taking this forward, which is a really great piece of news for me to hear. So you've probably seen this before, but this is the English NHS carbon footprint. When you go to talk to a lot of nurses on the ward, like I do, often they talk about, why can't we recycle more? That's their go-to, because that's what they do at home. But actually, that's only about 4% of the carbon footprint of the NHS is the waste that we create. So what I try to do is to get them to think about the medicines, the services, and the products that they use in everyday care, to see how they might be able to deliver things in a different way. I think showing them this is really helpful as well, because we always focus on that small, we always see it, don't we, the amount of stuff that goes into tiger waste that could probably go into a recyclable bag. It's important and it gets them talking, but it's not the thing that's going to make the big difference. What's going to make a big difference is buying greener and using things in a better way. Just Trump's definitely had a say on my slides moving forward, I think. There we are. So the move towards reuse makes greener cleaning even more important than ever, and I presented on the reusable tourniquets at an event yesterday for some NHS England, NHS North I think it was, and we had some really great questions that challenged that reusable tourniquet. How do we know that that reusable tourniquet has been cleaned appropriately, it's wipeable, and that we're not creating additional risk to our patients when we reuse something? And to me, that's really important too. It's patient safety always has to come first before anything else. But I also challenge them to say, how do you know that single-use one was actually clean? Because we don't swab the single-use ones, we assume they're fine, but they've been sat in a box that's probably been opened a few times by hands that haven't been decontaminated. It's sat in a slow boat from China, the ones we use come from China. So how clean is that single-use one? So actually maybe the reusable is safer. So it's just thinking, getting to help staff think in a different way. At the moment, we're very much in this linear economy where we use something once and we throw it away. And that's easy for staff because we're busy, we get it. But we can't continue like that forever because we've only got one planet. And so we need to make sure that we're reusing things where we can to keep those products and resources above ground and not incinerated or in your tiger bags or your orange bags. One of the things that I also share with staff is the product life cycle, and I've been having some conversations with the suppliers today about this. So there was an example of something that was made out of plastic on one of the tables out there, and we had to chat about why they'd made it out of plastic that was going to go in the bin. And it's really interesting because you assume that it's plastic, so it's going to have a worse carbon footprint than, I don't know, pulp or cardboard. So in order to know that, you need to understand a little bit about the life cycle of a product and where it's come from, and that's why when you do carbon footprinting, it's really complicated because you have to look at all of the different aspects of that product and where it's come from. I'm published in with my colleague Janice in the Nursing Times around the reusable tourniquet, and the data in there around the sustainability is there if you want to go away and read it. I'm not going to go into carbon footprinting today because we don't have time, but it looks at all of those aspects of the products when it's coming to you. What's coming next is the Department of Health and Social Care. I think it was last year, wrote a Design for Life paper, and myself and Rose were involved in that from an infection prevention and control perspective. How do we assure ourselves that moving to reusables is safe for patients? And where do we focus? What things should we be looking at, and where should we start, really? Because there's so many things that we could move back to when many of us in the room were baby nurses and we used to reuse things. What's safe to do, and what's going to have the biggest impact for the planet whilst not impacting patient safety and infection risk? So those are some of the things that we're looking at as part of that group, and Liz, who's in the room from Coventry and Warwickshire University Hospitals, is also on that group. And it's really important that we keep this grounded in, for me, clinical practice, because it doesn't need to sit there in the DHSC. It needs to work for us when we're out in practice. So it's really great that alongside the other co-chair, so I co-chair, and then Liz is coming along to give some support as to how we're going to roll that out in a way that makes it safe for patients. And it's practical, because often these documents sit in a department and then they don't really work for us. So that's a really important part of the role that I play. The other thing that, again, I'm working with Liz on, and some others in the room, we've been posed a challenge by our Midlands NHS England nursing and midwifery team, which is fantastic. I'm the lead for our ICS. Liz is the lead for UHCW, I think, and what we're looking at is how do we engage more nurses in this agenda? And they've challenged us to look at 4 different things. The first one was, can we map a clinical pathway and identify the carbon hotspots in that? And I'll talk through that in a minute. Can we increase the number of nurses that get to spend some of their working day focused on sustainability? So at Sandwell in West Birmingham, we had Ria Con work for a year in this area. That's what she worked 4 days in ITU and then 1 day doing sustainability projects. The changes that she could put just by dedicating that 1 day was immense. So she now works at NHS England. So can we get more of those hybrid roles? Can we reduce the use of one high-volume, single-use item? So that could be anything that we use a lot of. Tourniquets, pulp, will come on to that. And then can we increase the number of nurses that have done the e-learning for health module, or certainly have more of an awareness about sustainability and quality improvement? So those were the challenges posed, and our Midlands team, really well represented. Every ICS is coming along to that, and they've been set a challenge for 90 days to impact that agenda. So here's some of the ideas for the clinical pathways that we can map. We've got patient independence, which is the one that we're focused on in the Black Country ICS. Can we look at our continence pathway? Either looking at our continence products, do we have to go out to patients a lot? Can we perhaps not catheterise? And of course we talked about cortis and the problems that we've got there. So that's another great one. Reducing the use of a product to actually be better for patients, wouldn't that be wonderful? 2 others, leg ulcer pathway, and how can we move from analogue to digital with a nod to the Darcy review. So those were some of them, and the one we're focused on I'll come on to shortly, but we're looking at patient independence in the Midlands. So these are the numbers of products that are used in the Midlands in a year, and so we looked at the things that we use a lot of, and these things popped up. There's lots of others, but these were the ones I thought would map quite well onto the pathway, the patient pathway. We're still using disposable cutlery and cups, and who's reused their cup today from the... I forgot. But we're still using disposable cutlery and cups, which isn't great, and we use a lot in the NHS. Gloves is still quite high. I actually thought it was going to be more than 219 million gloves. The things you've used most were sugar sachets, how bizarre, and the other one, this is by number, not by cost and spend. And the other thing, apart from paper, was wipes. That won't surprise you, will it? So wipes was in the billions So which is better for the planet? And I know my Midlands IPC would be horrified that I put reusable urinals up there because she doesn't like them, and to be honest, neither do I. But it's something to think about, isn't it? So can we move back to reusables? Have you got a washer? But having heard about, what was it called? That's not spray, burst. Yes, burst spread. Yeah, let's not go there. What would be even better than using these products? And what we're looking at in the Midlands is bathroom first. So how we make it easier to reduce use of bulk products? Let's try to get the patient to the bathroom first rather than automatically giving them a wash bowl that leaks, so people use 2. We're actually finding they're leaking at the moment and we're using 4, which is horrendous. Can we just help the patient to mobilise, which is much better for patients, better for the planet, and it saves us money as well. So how do we move towards that? So I've just put a few ideas there as one of my final slides for levers to help you influence change, because it's hard. Change is really hard. Nobody's under any illusions about that. And I think it was Yvonne's slide this morning talked about finding different ways to influence, and I call it getting to yes. So don't take no for an answer. I very rarely take no for an answer. And so I use lots of different ways to think, okay, they've said no, so what else do I know about this? What evidence can I use to try to get to yes? And one of our deputy chief nurses also says, no's not the answer I'm looking for, so how do we find a way to get to yes? And I really like that as well. There are lots of different things that we can use in our clinical practice to persuade and influence. And that brings me to the end of the slide. So some references there for you. And our paper, Nash and Nelson, is the one on reusable tourniquets. And I'm on LinkedIn if you want to ask me any other questions.